why you've got to press the button. Well, I am Melinda Nusafora. I am a correspondent and a presenter for TRT World based here in Turkey, but I'm originally from Australia, and I am very pleased to have wonderful company on stage whom I will introduce you to very shortly. As I said, we are discussing equity in global health. Now, access to healthcare shouldn't be a privilege. It should be a human right, and yet hundreds of millions of people around the world still don't have access to even the most basic healthcare. In 2015, all countries in the United Nations adopted the 2030 Agenda for Sustainable Development. Now, that set out 17 goals to be reached by 2030, covering a raft of sectors, including education, human rights, climate change, but of course, health was one of them. It was Goal 3, and it was to ensure the health and the lives to promote well-being of people of all ages everywhere in the world, and it specifically states that in order to promote physical and mental health and well-being and to extend life expectancy for all, we must achieve universal health coverage and access to quality health care. No one must be left behind. And yet, here we are, only 7 years later, with a global pandemic shining a light just on how shamefully unequal global health remains. Health equality, though, isn't just a matter of being in a developed or a developing country, a wealthy or a lower income country. It affects communities within communities, even in more developed countries as well. Just as a personal example, I'm from Australia. I grew up in a country with a very high standard of free healthcare for everyone. And yet, Indigenous Australians in my country have a life expectancy at least 10 years less than the non-Indigenous population, and yet they have the access to exactly the same healthcare. So it just shows that it isn't necessarily country versus country when it comes to equity in healthcare. We must ensure that we're accessing all of communities within countries as well. It is a very hard ask if we are to live up to that 2030 agenda of no one should be left behind. There's a lot of work to do, and I have a wonderful panel here today to discuss how we do just that. So please allow me to introduce you to our panel today. We have D. Maxwell Sar Kamaya, who's the Minister of Foreign Affairs from Liberia. Thank you, sir, for being here. Beside him, we have Vincent Biruta, who is the Minister for Foreign Affairs and International Cooperation from Rwanda. Thank you, sir. Beside him, Princess Dina Mered of Jordan, the immediate past President of the Union of International Cancer Council, the largest global cancer-fighting organisation, and what has been described in some of my reading as a titan of health advocacy. So thank you very much for being here. And last but certainly not least, we have Aykut Özdarendeli, excuse me for my pronunciation there, Professor at Kayseri University and part of the team to develop Turkey's domestic vaccine, Turcovac, which is in the stages of being rolled out at the moment, which is wonderful to see. So thank you all so much for joining us. So really, we can't kick off a discussion about equity in global health without talking about COVID-19. Mr. Kamara, I'm going to start with you first. In your experience, how did the pandemic exacerbate or highlight the inequalities in global health that were already there?
Thank you very much, and greetings to our distinguished audience and my fellow panelists. It is indeed a humble honor to serve as a panelist along with my esteemed colleagues. Directly to your question, and thanks for moderating, uh, the COVID-19 pandemic has indeed highlighted uh, the gaps as it relates to global health, the inequalities, and in this specific case, as it relates to Africa. And this pandemic, as we are all aware, continues to leave devastating effects as it relates to the globe, and in this particular case, Africa, with Liberia, our country, being of no exception. Every fabric of our society has been affected, globally with respect to the pandemic. But the gaps, as we are talking about, for instance, in the year 2021, out of the 6.4 million doses that were of vaccines that were administered globally, it's just 2.5% were administered to Africa. So that speaks volume with respect to the gap as it relates to the inequalities in the vaccine. And we are all aware that with respect to COVID-19, unless everyone is free of the virus, no one is free, and in line with the global concept as it relates to the United Nations of leaving no one behind, that is not applicable with respect to the COVID vaccine. So the need is so high, with respect to that. We are not given priority as a continent, Africa to be specific, and Liberia being of no exception, even though back home the situation as it relates to COVID is relatively has been managed. Liberia was in fact among 20 countries globally that were doing very well in terms of managing the COVID-19 as it is. So, and that speaks volume also to global leadership. But when you look back, the gap is high, and this is why the rich countries, the G20 for instance, Africa, we should be able to speak so that we can narrow the gap. And more importantly, this gap has also shown the challenge that the health system, across the world, and in particular Africa, is faced with respect to that. Because besides the issue of COVID, there are other illnesses that could be managed, but because of the challenge with those, so some of those illnesses too, there is a challenge in terms of having remedies for those illnesses. So the need for the world and Africa, the voice to be here in terms of working towards narrowing the gap cannot be overly emphasized. We do appreciate very much the effort that has been made by the international community through different initiatives, the COVAX facility, the African Union-owned vaccine initiative, even Turkey, where we are here, the president and the government and people of Turkey have been making effort with respect to that. Even this year, we expect in this quarter or next quarter, the support that the gesture on the part of Turkey as it relates to fighting COVID-19, that it will be heard, but I mean that it will be materialized. But with all of that, the gap remains, and in Africa as a whole, not more than 2% as it is being served with respect to that.
It's still so low, isn't it? It's still so low. And you made a couple of interesting points that I am going to come back to, particularly with regards to the comment you made about with the need to be fighting COVID, access to other health treatments, etc., then fall by the wayside. And I know that that is something that Your Highness Dina Mered is really going to want to discuss. We're going to get to that in a little bit though. But Mr. Baruja, I want to ask to you, there have been some positive stories of international commitment, the world working together to try and promote equity during this pandemic. But it was a little bit of a utopian dream, this COVAX. It didn't really achieve what it set out to achieve. Do you agree with that, that it hasn't reached its targets, and why do you think it has fallen short?
Thank you. Let me first of all say that I am happy to be part of this panel to discuss global health equity with colleagues here. Yes, COVAX, I think COVAX made some achievements, but COVAX was a tool which could not work without health systems which are effective and which could deliver. COVAX could have been able to deliver vaccines, but without health systems which are effective, those vaccines will not be able to be delivered to those who needed them. So in terms of response to COVID-19, the countries which succeeded in giving a good response to the pandemic are those countries which used to have a health system in place with the right infrastructures, with the right policies, and with a clear leadership in relation to health matters. Otherwise, COVAX was able to put together vaccines, to have contributions from various countries, but even when those vaccines are available, in some countries, it was not possible to deliver them to the people. And in some countries, people were not even accepting those vaccines. So COVAX, I think COVAX has made some achievements, but for COVAX to be effective, we needed to have leadership in various countries. We need to have health systems in place, health systems which are effective, so that we just don't collect vaccines, but we are also able to deliver them to the people who needed them.
So it kind of comes down to already having, like you say, that infrastructure in place, which I guess is the foundation of global health equity, that everyone, you know, is starting from the same level playing field. What has sort of jumped out to you as being lacking the most, whether it's Rwanda, whether it's your neighbouring countries or the continent in general? What do you think that this has taught a lot of countries about maybe where they need to begin?
Yes, I think what lacked the most from the beginning was leadership. Yes, leadership means that government needed to understand that there was a pandemic, that they needed to put in place the right strategies for them to be able to prevent that pandemic from killing their people, and to have a plan. When vaccines were available, we needed to have a plan in place to deliver those vaccines to the people. So leadership for me is key. Then the second point is health systems, effective health systems. So in countries where there is no network of health facilities in place, where you don't have human resources in place to be able to reach the people, then it doesn't matter to have vaccines or not. Those vaccines which were made available needed some logistics to be put in place first to be able to store them, then the necessary logistics to distribute them, and human resources on the ground to be able to deliver those vaccines to the people. And, of course, leadership, just to convince the people that they are safe in taking those vaccines, because we have countries where those vaccines were available, the logistics were in place, but people were not responsive. They were not taking those vaccines. So it is a certain number of factors: leadership, health infrastructures, human resources, strategies, and plans to distribute and administer those vaccines to the people. All these makes the whole. It is not just one factor. It is an addition of factors and conditions.
You raised something that I did actually want to discuss with Mr. Özderendeli is about vaccines. You are part of Turkey's domestic vaccine production team. It's not just the science of making vaccines which can provide, such beneficial health outcomes to the world. As we just heard, you need to encourage people to take them. How challenging can it be, whether it's a new vaccine or an existing vaccine, to encourage and educate the population that vaccines are safe?
Okay, thank you, Chairman, and I offer my respect to all participants. Welcome to Turkey. Vaccination has been very important and very cost-effective public health measuring and to prevent and control many infectious diseases so far. For example, the world, eradicate the pox virus, smallpox virus, by using the vaccines, and we control the measles, rabies, and polio by vaccination. So the benefit of vaccines are so important. So we're, facing COVID-19 pandemic since 2020. The pandemic remained to be a global health problem, posing very economic crisis and social burden. After getting the whole sequence of SARS-CoV-2 virus, stimulating very important development of the vaccine studies in the world, and many vaccines have been developed in record time. After the pandemic, within the 1 year, some vaccines already being used as emergency use.
That speed does make some people apprehensive. How do you convey the message that just because it's been fast doesn't mean it's not safe?
Yeah. As I said before, we control a lot of infectious disease by vaccination. We know that some hesitancy of the vaccination in the people and social media, but most important thing is that the cost effective to protect the people from the infectious disease outbreaks and pandemics. Vaccination is the most important tools the people have. So for the COVID-19 pandemic, we faced that kind of very devastating problems, and we lost a lot of people, in the world. More than 430 million people confirmed cases, including 6 million people already dead because of the virus. Vaccination is one of the important tools for protect the people, actually.
It is indeed, and thank you for the work that you have been doing. Yes, I'm going to hand over to you now, Dina Murad. You wrote in an opinion piece for CNN in June 2020 that the pandemic unmasked a lot of uncomfortable truths about global health system. What do you think those uncomfortable truths are?
Thank you. Yes, I come from, my background is dealing with cancer and advocating for cancer and non-communicable diseases. And as we speak today, here we're talking about 5 million deaths from COVID, But for non-communicable diseases, especially cancer, every year 10 million people die, and 70% of which are in low middle income countries. And what I said in that CNN op-ed is that COVID-19, actually brought home the misery and the tragedy that has been faced by millions of people in low middle income countries, especially with cancer, for example, that suddenly they ended up facing it, it reached their shore, shall we say. The miseries that people face every day, not finding medication, not finding treatment, not finding this. So it brought it home. So that's one of the truths. And actually, with this crisis, I think, we can go beyond, when you talk about health equity in this panel, we should be talking about all diseases again, because every time we keep focusing on infectious versus non-communicable, who actually non-communicable diseases are the single most killer in the world. We shouldn't. We are one human, one body. We cannot divide it into parts. So that's one. So I know we're talking about vaccines right now, but again, cancer sufferers suffered the most, double burden with the corona vaccine and non-communicable diseases. But anyways, if you want to talk about health equity, it really goes back to actually, especially now with the vaccine, I don't think the big majority of the problem was just vaccine hesitancy. There was a lack of equity in sharing the vaccine. Let's just put it out there. There was a, high-income countries, they were the producers and their company, the big pharma companies producing all these vaccines, great for all of us, but there wasn't the equity imperative at the foundation of them. Everybody went for their self-interest. Human nature at its basis, definitely. COVAX, of course, that was a big attempt by WHO and other partners to provide equitable access to the rest of the world. And yes, it only works if all other parties then actually make contracts to COVAX and give donations. So it started, but it started late. And yes, Africa still had maybe less than 10% of vaccines. But there's another equity issue. This whole idea of also sharing R&D, sharing technology, sharing information, this whole tension between patent laws versus public health. This happened before. Let me remind you, in 1998, Big Pharma took Nelson Mandela to court. If you remember with the AIDS, when the AIDS story happened, because South Africa decided to make their own, the whole world was ravaged with AIDS, especially in Africa and South Africa. It was so expensive because of all these propriety laws, intellectual property laws. And so South Africa decided to take some kind of understanding from the trade agreement TRIP that they can do generic medication because of the public health question. And Big Pharma wanted to take South Africa to court. But then it became such a PR disaster for them that they actually stopped. So we have been there before. That's the problem. We need to now take stock, strengthen the global health infrastructure, strengthen the governing laws, many of whom, by the way, they've been maybe outdated. Maybe some were done 1998, some 2005 or something like that. They need to be reassessed and re-updated to deal with the landscape today. So that's one. People travel more, there is a lot more globalization, etc. Viruses move quite freely, and so on and so forth. So that we need this, solve this lack of issue of, because even it happened with the vaccines, there was a delay in sharing information. Why shouldn't countries be able to do their own capacity in their own countries? If you help countries develop capacities for producing vaccines and pay for licensing, then that local capacity producing vaccine will help the system of delivering vaccines all over the world. And ultimately it's a question of solidarity. You cannot have it all based on and you have to strengthen WHO. WHO cannot do things. They get funding always on voluntary basis. They don't have a set budget that what they can do. Yes, it's not a perfect organization, but work to make it strong, because what we saw is vaccine nationalism, yes, and it is very clear you can't leave it to countries to rely on their conscience. That became very clear, right? Everybody just took to help their own. So you need real rules, real agreements to be really ironed out again, to make sure that, because we will have another pandemic, that seems to be an evolutionary certainty, we have to now take stock of what happened and have proper preparedness for the next pandemic. And also not to forget that we are one body. We cannot just be always worried about the virus. Viruses are important, but there are other serious diseases that we also shouldn't neglect. Just because they don't affect us and don't come to our shores, cancer is not contagious. Sometimes people wish it is in low middle income countries so that people will take attention. We need to rethink and reimagine public health with equity front and center on every single policy, so that, like you said, minorities in Australia, if they put a policy for vaccine take-up in your country, they should understand why is it that indigenous people are not. Why is it, for example, black people in America have more mortality rate, or they haven't taken up more vaccine? If you put equity at the center of every policy that you take, it can be solved. But it has to be not an after the fact, it has to be as you are formulating the strategy.
Well, that is interesting, because there has been discussion about that this whole COVID pandemic disaster has highlighted that perhaps it is time to restructure the World Health Organization, that it didn't operate as effectively as a lot of people had expected it would. So maybe let me start again with you, Mr. Kamaya. How do you feel the World Health Organization, well, do you think it has done a good enough job? And going forward, with regards to health equity, do you think it needs a big shake-up?
Well, I would say that the WHO, or the issue with respect to health, should not be politicized. And most times, that's what we see. As it relates to the African common position, Africa, through its institutional means, like the African Union and others, we do support uh, the leadership of the WHO and the work being done under the circumstances. It is most times very easy to point a finger. When you look at the WHO, look at what is unfolding, even as it relates, yes, while it is true that there is a room for improvement, which is not peculiar to the WHO, even in our respective places, even us here in our personal lives, there's always room for improvement, but they are doing their best under the circumstances. What I think we need to tackle is the issue of political will, across the globe, in terms of looking at what WHO is doing, and then we'll be able to work. How can we blame WHO, for instance, Africa, like I indicated earlier, which is according to the World Bank data, 6.4 billion doses of vaccines administered, and out of that, 2.5% were administered to Africa. How do we blame WHO? How do we blame WHO for 89% of vaccines that have been procured, were procured as we speak by the G20, which is the richest countries in the world, as it is. And even out of that 89% that they've procured for future delivery, and which you can verify, The G20 countries hold on to 71% of the vaccines that are available to go. They're there. How do we blame WHO for that? So our
So
thing,
where would you like to see a change? Where does the leadership need to come from?
well, there has to be global leadership. Like I said, there has to be political will. And
How do we get
inequality, not just in the health sector. Equity is a key element of governance. Where there is marginalization, just over time, you are bound, for problem. So we need to understand, and we think that the G20s, the richest countries in the world, the 20, have a responsibility. I think beyond moral responsibility, it is a necessary imperative for them to realize that the issue of health is a right, and they need to work with those other countries that have less opportunities to see how the issues of health can be addressed. And we need to look at, like she said, we need to look at the situation not just from a pandemic standpoint, or from a public health perspective. We need to approach it from a strategy of health resilience of the whole. We need to look at it from a holistic standpoint and look at the health sector and ensure that the systems, to be in place are systems that will be resilient, to be able to meet the challenges with respect to the health sector.
Now, Mr. Baruta, you were being praised by Her Royal Highness before our panel began about Rwanda's response to improving its health infrastructure, its health system. Can you give us a sense of why Her Royal Highness thinks Rwanda is doing such a good job?
That should be responded to by Royal Highness herself. But what I was just saying a few minutes ago is that leadership is key to everything, every program you need to deliver on. Leadership is key. Let me maybe refer to our response to COVID-19 we were talking about. In Rwanda, we didn't wait for COVAX to start delivering vaccines. We first of all put in place the logistics which we needed to be able to even to receive the vaccines, and we put in place a plan, we adopted a plan to distribute the vaccines once we have them. We didn't wait for donation, we didn't wait for WHO to put in place that system. We worked on the system ourselves as a government. And we started sensitizing the population about the importance of the vaccines. And in Rwanda, it is true we have a good infrastructure, a good health infrastructure, a network of hospitals, health centers, health posts, and so on and so forth. Maybe that one element Royal Highness was referring to. So we have that in place. But we have also a community health insurance which covers 90% of our population, at least. So that's a system which is in place and which allowed us to be able to receive vaccines and to distribute them, and the population was prepared to accept those vaccines. And we didn't even wait for COVAX to give us vaccines. We bought vaccines, we bought doses from Pfizer, we bought vaccines from the Serum Institute of India. So we just adopted a budget and we bought. We bought the fridge, the cold chain we needed to be able to handle the vaccines. So that's what I was meaning by leadership. So maybe that's an example I can share on how we were prepared, how we responded to the COVID-19 pandemic, but we could not have done that without having already a system which was in place, the right policies.
And do you think the lack of that fundamental system is what is perhaps causing a lot of problems in other countries when it comes to delivering the health services that may be accessible to them.
It is key. When you have a pandemic like the COVID-19, you could have vaccines, but if you cannot handle them, if you cannot store them, if you don't have a system to distribute them, if you don't have the right policy to be able to sensitize the population, so those vaccines will just be destroyed at some point, and that has been the case in some countries. So a resilient health system is key to deliver on every and each program, be it a vaccination program or treatment program. That is the basic we need to have in place to be able to face any threat to the health of our populations.
Johannes, do you have anything you want to add to that?
Yeah, I think His Excellency, the Minister, said something very important, and I totally agree with him. And this was actually our story in Jordan when we were trying to fix cancer care in our country. And, you know, and when I became president of UICC, when I visited everybody around the world, I would tell them, you know, of course, partnerships are very important, but the country has to own it. And this is, I think, what His Excellency says. You know, you can bring the horse to the water, but you cannot make the horse drink the water, right? And that was our situation. The country has to also know its gaps and what it can and what it cannot do, and it has to own it. If they just say wait passively to receive support, nothing is going to happen. And I think this is what is great about Rwanda, in that, you know, they have great leadership that put health as a priority for their country. And when the Partners in Health organization, great partners, came to Rwanda to support, they saw an amazing partner, because don't forget, NGOs who want to help, they don't want to go somewhere and be frustrated as well. So when they see the country has owned the situation, and they know what they want and they know what they don't want also, so they had an amazing partnership, and they started to put the right foundation. The reason I'm speaking so passionately about Rwanda, because I went there and I saw what they've done. They did what you say, the boring bits. Started to, like he said, put a system of community workers, actually promote women in the workforce. They've had a woman health minister. Jordan didn't, and I've spoken about that recently, and not many happy faces in the audience. So they did the boring bits, laying the right foundation. So I suppose you're right. When COVID-19 came, you already had the system in place, and the trust in the government that they are, already making markers in their KPIs. I mean, Rwanda, for cervical vaccine, they vaccinated 90% of their girls already. So they are already, doing all those. So the country has to, take charge. Otherwise, you can't just wait helplessly, oh, help me. No, that's not the way. Everybody knows what to do. And most importantly, I would say, they started to build a university for medical students and global health equity. And what's important about that is all the conferences I've been to, and I promise you hundreds since 2008, everybody talks about it's so boring. There's a lack of capacity in Africa, there is this, there is that. They actually did something about it. And it shows nobody is going to help you. Nobody is going to come and build you a university. Governments can take charge and put a plan. And yes, it will take time, but it's happening. Rwanda has just graduated the first cohort of medical students from this amazing partnership, Partners in Health with Rwanda, called University of Global Health Equity. And so hopefully we will stop hearing about this horrible statistic that Africa has nothing. So, and this is what has happened when you took charge. So.
I know you want to respond to this as well, please.
Since beginning of the pandemic, WHO asked the countries who produced some vaccines and some companies also to share information, know-how, technology transfer, and licensing especially. But I think most of the countries miss that kind of opportunity, don't share any licensing thing, and I think that's the problem. So I think the lesson we got from the COVID-19 pandemic, building a local manufacturing of the vaccine would be so important. So other thing is that the COVAX and African Vaccine Acquisition Trust also made some contraction with the manufacturing sites. As far as I remember, 5 billion doses of the vaccine in the agreement with the COVAX and AWAT. But just 15% of these vaccines just supplied to Africa and poorest countries so far. The other problem is that the poorest 30 countries just get vaccinated 2%. This is other problem. So in Turkey, in our country situation right now, 80% of the population got fully vaccinated right now. So leadership is important. So Turkey initiated a vaccine development program, Turkovac, which is inactivated cell culture based conventional effective vaccine. So we finished the preclinical studies and phase studies. Phase 3 studies still going on, and we got the emergency use just a couple months ago, and we're producing the Turkovac vaccine 1 million per month. And Turkey sent over 1 million vaccine doses to Africa countries. So
do you think this opportunity of domestic vaccine production, which COVID has spurred along, is going to help the global community into the future now?
of course, especially the next pandemics or outbreaks, it should be. But right now, we have enough vaccine doses in the world. Almost 1 billion doses produced every month. So the problem is that we can, supply the vaccine the people who need it. That's the big problem, actually. I think in the next we need to take the lesson from the COVID-19 is the local manufacturing is so important, and international community should take some actions to ensure all people get vaccinated, because no one is safe if everybody gets vaccinated.
I think, I don't know about our audience, but for me so far, I feel like a real message that has stood out to me about overcoming some of the challenges of global health inequity is leadership. It's not training more doctors, building more hospitals. It's having the leadership and the political will to actually do it for yourself. And that has really stood out to me. And if I could just share a personal anecdote on that. As I said, I'm from Australia, and I know there's been a lot of commentary in my country about the lack of political leadership with regards to COVID vaccines. I mean, like I said, vaccines were readily available, they were free, they were ready to be rolled out, and then the Prime Minister made a silly offhanded comment during a press conference, and within a day people cancelled their COVID vaccination appointments because they lost faith in the vaccine, in the program, and in the government's ability to deliver it. So by the time I had my second dose of vaccine here in Turkey, my mother, who has cancer in Australia, hadn't even had her first vaccine yet. So I just think it's such an example of how the message that our panellists have really raised really does ring true, and it's only just kind of really occurred to me and crystallised in my mind that leadership really is so important. I could keep asking questions to you all day, but we are going to run out of time, and I want to open it up to the floor in case anyone here has any questions as well. Before we do, I'm going to invite our first responder from the floor, Mr. Carlos Ron, who is Venezuela's Vice Minister for North American Foreign Affairs. Sir, if you would like to, we're just getting a microphone over to you, if you want to just stand up. Thank you.
apparently it works. All right. Well, thank you very much for this panel, this wonderful presentation Your Excellencies are making, and thank you very much for this opportunity. I think that just a reflection on what you've commented, the in general, humankind as not only leadership in individual countries, but also leadership and the political aspects surrounding the vaccines and the attention of COVID, coming from countries that have, like your princess said before, that have hoarded vaccines, that have that this vaccine nationalism. We have experienced in Venezuela something very harmful as well, which has been the use, the political use of the unilateral sanctions against Venezuela in affecting our response to COVID-19. Last year, for example, when we were trying to obtain our doses from COVAX, the payment that was issued by Venezuela was we were almost fully paid for the vaccines, and it was blocked by the United States policies against Venezuela, against our payments, and the bank seriously delayed the possibility for us to acquire these vaccines. Other elements that we've seen recently, countries, for example, not donating vaccines to other countries because of their political position and with the situation that's going on now in Ukraine or other issues of the sort. And I wanted to ask the panel, what's your take on this? How do we respond, since we're in diplomacy forum? Can we respond with diplomacy to these type of lack of political will or the political use of the vaccines as a tool to pressure some governments? Thank you very much.
And I'll open it up to anyone on our panel who wants to respond. Yes, Your Highness.
That is why I believe we should strengthen multinational organizations such as the WHO and give them sustainable funding, fix whatever we need to fix so that they can do their job better, so that issues like that are not affected by politics or favoritism or whatever you call it, because these are humans at stake. Look what's happening in Ukraine right now. You've got over 2 million refugees. Don't get me started on cancer and refugees. I mean, that's another ball game altogether, that there is no infrastructure at all right now to actually support cancer patients who are caught in conflict. And here, we're not just talking about Ukraine, we're talking about Syrian refugees, Iraqis, Palestinian refugees, whatever. So we need to strengthen the infrastructure for the global infrastructure for these kind of situations, so that we don't wait just for goodwill. If somebody likes us or doesn't like us, you should have a very objective organization with a proper plan of preparedness for when these things happen. And countries have to pay up. WHO cannot do everything. They can only do what they are given money to do. And so far, Dr. Tedros said it's mostly voluntary, contributions. And when there's panic, they give them. When there's no panic, it doesn't happen. You can't run an organization like that. So this is what needs to happen, along with other things, building capacity at home, in local places. And I mean, it's crazy. I mean, if you think about it with vaccines, it's like having, not sharing vaccines. It's so crazy, especially with this virus. It's like having, a neighbor with a plot of land, and you have a plot, and every year your neighbor, something happens and his land has fire. And of course it affects your land. You have the well, but you won't share the water. It's crazy. And then you are surprised why it keeps on and on and on. So, the world has to take stock and to really not repeat the old mistakes and give licensing, share know-how, share knowledge. I mean, you told us they delayed in sharing knowledge. By the time it ravaged all economies in the world. This has to stop, and a proper system of governance has to happen with big political leadership, because big problems need big political leadership to solve them.
Mr. Kamai, I saw you nodding your head at some of that response, and you also said that there shouldn't be the politicalisation of health distribution. Is there anything you want to add?
Well, except that vaccine nationalism is also a key factor, as he indicated, with respect to uh, the inequalities within the health system. And that's why we need to work towards consolidating efforts towards health multilateralism. You know, it is very much key. And through health multilateralism, we'll be able to address uh, challenges such as what the princess talked about as it relates to WHO, you know, through that. And which has long time been a challenge. And we are all aware that besides even health multilateralism as a whole has been a challenge a very long time. We just from an opening program, we heard, you know, comments from there, practical comments and all of that. And we must face it. These are the kinds of challenges we have. You know, Africa has been making effort to manufacture vaccines. We're talking about Senegal, South Africa, we talk about Rwanda. But look at the continent, 1.3 billion. We have a population of 1.3 billion. Look at the number of countries that making effort in terms of manufacturing. But there has also been a challenge in that area in terms of patent right, you know, which has also been political, you know, which has affected the production capacity or efforts with respect to Africa. So we have to be realistic. And like I indicated in my earliest comments, you know, the issue of addressing political will, but also the people. We must be realistic also. The people. There are times, like our country, we experienced the Ebola virus disease in 2014. There was a situation of denial on the part of the population. There are people sometimes don't trust, not just Liberia, globally, what the government says with respect to these things. So also the attitude of the people. So this is where sensitization and awareness to ensure critical consciousness as it relates to these situations when they unfold can be key to addressing the situation. Thank you.
Thank you. Does anyone else have a question to our panel? We've got a question at the front, please.
Mihal O'Hurley with Diplomacy in Ireland, European diplomat. My question is there a political appetite to address the inequalities in the structures that make decisions? In the past, it's been those people who have donated, big countries, who have dictated how vaccines and other humanitarian and healthcare efforts get rolled out. If anyone was to design a system to give equality, they would invite the end users who go unserviced. Do you think that, given the lessons of the pandemic, the crisis in Ukraine, Syria, Sudan, all around the world, there's finally the appetite to create systems fit for purpose?
Would anyone like to jump on top of that one? It's a good question.
We hope so. I mean, if after the corona we still haven't, you know, it hasn't hit home, when will it ever?
I think that's a good question. Actually, I would like to make a comment on it. For the, COVID-19 pandemic, we learned that we can produce vaccine very fast, less than 1 year. But for the next pandemics or outbreaks, we should work on how to collaborate to each other, and the international community should bring the countries together, make a good agreements with the COVAX or other agencies, and be prepared for the next pandemics, I guess.
Thank you. Anyone else from the floor before we wrap up? Okay, we will leave it there then. Thank you so much to our audience and our guests here for joining us for this very important discussion, and of course to our esteemed panel for your insight, your contribution, and really, I think, bringing to light so many issues that have crystallised things in my mind, and I hope it has for our audience as well. Thank you so much for your time.
Thank you.